Alrighty, so we are officially ready to start. So, good morning, everyone. Thank you so much for joining us today. We probably have a couple of people that drop in, as we continue today's conversation. But welcome to Coffee Conversations hosted by Forge. We have the honor of sitting with UAB Palliative Care, specifically Ms. Audrey Landry. And before we get started, I'm just going to go over just a few housekeeping rules. So, the first portion of today's conversation will be recorded and it will be available later for viewing on our YouTube channel. After we go through today's questions, we will turn off the recording and give everyone the opportunity to ask any questions. Please feel free to unmute your mics, or if you want to drop your questions in the chat box, you're more than welcome to do that, and we will address those for you. So I have the honor of introducing today's speaker. So Miss Audrey Landry was raised in Walker County, Alabama, but calls Shelby County her home. After an almost two-decade career as a paramedic and educator serving is a paramedic and educator serving Central Alabama, she changed her course in healthcare to become a registered nurse, earning her ADN from Jefferson State Community College in 2019. Her career in nursing began on UAB's HSD2 acute care step down unit, where she became assistant manager. Soon after, she was afforded the opportunity to transition from bedside nursing to palliative care palliative care clinical coordinator for patients with serious illnesses. Since joining the palliative and supportive care team, Audrey has earned both her BSN and MSN in nursing education. She is mastered DISC certified, and she is also a member of the Department of Medicine Wellness Council and helped lead the Palliative Care Accountable Care Team. Audrey has a strong drive to improve difficult conversation, communication curriculum, and nursing education. She's best known as Lady by her family and friends. She lives in Alabaster with her husband, Joel, and she enjoys spending time with her five children and five grandchildren. Audrey, thank you so much for taking some time out to chat with us this morning. We're so honored to have you, and we're extremely excited about this topic. So, I guess to get things started today, could you let us know or just share like a general overview of some of the things that you do with UAB's palliative care and some of the services your team offers?
Sure. So my role in the palliative care team is as the coordinator for our inpatient team. We get consulted on patients who are within the hospital at UAB and UAB Highlands. And then our team will go out and help them discuss goals of care, help with symptom management for those patients who have life-limiting illness. Um, our palliative care team is rather large. It encompasses multiple areas. We have an inpatient consult team who sees those patients that are here in the hospital. We have a supportive care clinic, which is an outpatient clinic who has nurse coordinators, medical assistants, physicians, nurse practitioners, um, psychologists, counselors. We have a massage therapist there, nutritionist, um, chaplains, and social work to help manage the symptoms and stress that
Yeah.
comes along with serious illness by focusing on quality of life. We also have our team has its fingers in palliative care at the VA, at
Mhm.
Children's, and we have just started a perinatal palliative care team here at UAB's regional neonatal ICU. So
It's new news to me.
we have a very large team because we care about making sure that we support people as they journey through this time of their life.
Gotcha. So it seems like palliative care is pretty all encompassing and expansive. And so I'm sure your team over at UAB, you guys see a lot of people. So at what point do patients usually start their palliative care journey?
Optimally, The palliative care journey would start at diagnosis.
Mm,
We are able to, we're different. People sometimes confuse us with hospice. We are
mm,
we are not hospice. We can work with hospice, and we have a lot of overlap. But palliative care is really um, great to have at the diagnosis of serious or chronic illness, not just at the end of life, because then palliative can walk with you through your journey as you're getting treatment. Um, and then as things progress, because we know sometimes they do, then palliative care can work with you to make those decisions about when to come in with hospice and how best to manage you through the end of your life.
gotcha. Have you noticed like any barriers to patients starting their palliative care journey?
Fear, there's a lot of fear, a lot of misconceptions because, like I said, people hear the word palliative and they automatically think hospice and end of life, but that's
Mhm.
not always the case. There's also barriers are, some of those things would be transportation to get back and forth to clinic. Um, there's a lot of places in Alabama and in the South, especially, that where we have healthcare disparities, where people are not able to get to the services that they need. Um, and we're working towards that, but it's very small steps that happen. So fear, transportation, and access, caregiver burden is a lot of a barrier because 70% of the caregivers for people who have chronic and life limiting illness are their families. So they have to navigate working and taking care of their family themselves, plus caring for their ill loved one.
And it can be tough. We see similar situations here at Forge, and so it can be daunting for not only the client but also everyone who's in that person's network. And so, like you mentioned, like those barriers with like access to care, fear, and things of that nature. So, my next question would be: how does your team support patients beyond medical?
We have, let me make sure that I'm answering this correctly. So you're talking about like emotional and social support?
Yeah, and specifically like addressing some of like those barriers to care, or like at least barriers to starting palliative care. So like if someone is anxious about starting palliative care, or if you have patients who live in more of like the rural areas of the state, and they are having issues with getting to the clinic, how does your team support individuals in those situations?
So we have a very robust psycho-oncology counseling team, psychology and counseling team, um, who we can see patients through telehealth with them. The biggest thing to do in order to get over that fear is education. Just talking to people, letting them know this is who we are, this is what we can do. And then we have partnerships with other entities throughout the state who give palliative care because, we have in our under our umbrella, we do have a team of physicians and fellows who can go
Mhm.
to the home to
Okay.
see patients for palliative care, but it's a very small team and they have logistics that they have to fall under, so they can't go beyond a certain range. However, we are strong partners with other companies within the state who do have palliative care to offer. Some of those companies also offer hospice care, but we partner with them to help get those resources out. We also, with that education, we want to make sure that we know that the community resources are there. So, maybe that might be just as simple as us coming and talking with church leadership in a rural community to let them know, this is how you can help your families in your community who have serious illness and those type things. So a lot of outreach, a lot of education.
Yeah, and I'm so happy you mentioned that because that kind of goes into my next question. But I wanted to know, and like you said, education is a great tool for individuals to learn more about like available resources, just so they can get more information and just being able to make an informed decision on how they choose to go, like within their treatment plans. So I would be interested to know what type of educational programs does the UAB palliative care team offer? And what does that look like if someone is interested? How would they go about accessing those resources?
Um, Accessing the resources is as simple as going to the UAB Center for Palliative and Supportive Care website. You can Google it, UAB Palliative Care, and it's going to pop up right on top. And we have education programs through the center. Um, a lot of our education is geared more towards providers, so the clinicians, the doctors who see patients, um, and just making sure that we know how to communicate effectively with patients and families who might need our services. But we also we attend different things, health fairs and the like, to get the word out about what palliative care is, and then partnerships with entities such as yourself, just to come in and have conversations just like this to talk about what palliative care does, how we can help, and offer, our support to you as you support those people who come for your services.
Gotcha. And thank you so much for answering that. And I do want to take it back just a little bit. So, and this would be like a scenario based question, but let's just say you had a client who's like newly diagnosed and they are, just kind of trying to get everything organized since, you get like all this new information and things of that nature. How would a client who's interested but hasn't necessarily maybe been recommended or referred palliative care, how could they go about with getting connected to either you guys or a community resource that offers palliative care if they are interested?
Call us.
Gotcha.
Um, Myself and the other RN coordinator, Miss Jackie Palmore, we do a lot of talking to people. They just call UAB and they say, hey, we want to talk to somebody with palliative care. And so we get those calls and we're happy to talk about what options you might have. You can also, again, Google palliative care and we'll come up. But then there's also services that'll come up, the different companies in the area who offer palliative care. But really, the first step is just giving us a call. We'll be glad to help you find those resources, and talk with your physician. Tell them, hey, this is scary. I'm in a place where I'm not sure where to go next, and ask, are there resources for me? The Especially for your clients in breast cancer, um, we have a strong presence at the Cancer Center at UAB, and we make sure that people know that we're there. So, just talk with your physician and say, hey, who can help me with this? Is there someone who can walk with me through it? And lots of physicians know about us, and so they can refer them to us. But really, just give us a call.
Yeah, and I can attest. We have a couple of clients, as you may know, who actually go to the Kirkland Center at UAB, and they are amazing with referring and giving out resources to clients. So if anyone is watching who might be a patient with the Kirkland Clinic, you can ask them, and they will. I'm sure they will get you connected. They are amazing with doing that. Is there any criteria a patient has to meet in order to qualify for palliative care, or is there a such thing as being able to qualify for palliative care?
Well, for palliative care, you would need to have a serious or chronic life-limiting illness for us. So, um, is that always cancer? No. COPD, congestive heart failure. We help with those illnesses and diseases that will limit your life expectancy and limit how um, uh, you can navigate. So, Parkinson's, end stage lung disease, end stage heart failure, of course, cancer. Those are the things that we want to be most present for,
Mhm.
because we know that those are going to have the highest symptom burdens. We're going to need caregivers and caregiver support. And maybe just navigating advanced care planning is something that we would help with, because maybe they don't need caregiver support at that time, but they just need to talk about the what ifs and what next of what matters most to them. So, but yes, a chronic life limiting illness would be the qualifications. That sounds awful, but yeah, that would be,
Yeah.
yeah,
Yeah, I know. And when I asked that question, I was like, oh, this sounds a little yucky,
yeah,
but thank you for answering it because, there are people who could benefit greatly from palliative care and they may not even know that they can qualify or that they could benefit from it. So
right.
that would be extremely helpful for individuals who are just trying to get their footing and gathering resources and exploring things that's out there for them. Um, my next question is, what feedback do you hear most often from patients about what they wish they had access to sooner?
I think the number one um, feedback that we probably get is just being grateful that they have someone who can help with that aggressive symptom management and wishing that they could have had that sooner so that their quality of life was not negatively impacted by their symptoms. Because as you go through treatment, especially for cancer, you're going to have a myriad of symptoms that come from those side effects. So, the nausea, pain, just the general overall feeling of feeling bad. So a lot of people will say they wish they had had access to us sooner to help mitigate those symptoms. Um, and then they also appreciate the fact that we can help navigate that communication aspect to get clear communication with their physicians, helping them figure out what to ask and how to set expectations based on what matters most to them.
Um, I guess my next question is, what's the best way to stay connected and to continue this conversation? So I know you mentioned Googling the UAB palliative care, but is there any more information that you can share if someone is just wanting to learn more or get connected to someone within the palliative care team?
Definitely reaching out. I think one of the things that we can all do is partnerships. So
Yeah.
partnerships with organizations such as yourself, um, making sure that we as palliative care are out in the community at those health fair resources. And if you have a question, just seeking that response from your physicians, asking those questions. Is the best way to figure out what your next steps are. But definitely for community outreach is pivotal in making sure that people know what's out there, and how we can be a benefit to them. So definitely sharing resources and identifying places where we can collaborate and work together to benefit our clients.
And we are happy to be connected to you guys. UAB, they're a great partner. They really are. And I feel like all of the providers that I've come across and clients that I've gotten the opportunity to work with, they have nothing but great things to say about UAB's team. So you guys are amazing, and we are grateful for this partnership. And this is the question I should have asked earlier, but if anyone is in the state of Alabama and they are not a patient at UAB, but they want palliative care, do they have to be a patient at UAB in order to benefit from you guys' services?
Not necessarily. We get a lot of referrals from other physicians, clinics that they want us to help with services for their patients. Some patients self-refer, so they get this diagnosis and they are, um, we've getting calls from Georgia and Tennessee and Mississippi all the time of they're saying, I just was diagnosed with this. What can I do to get in there with you guys? And so, we can request medical records and they can self-refer. There is a wait list, unfortunately, but we do endeavor to try to help as many people as we can. Um, so it's not necessarily you have to be in Birmingham or Jefferson County. We can offer services to people outside of this general area.
Amazing. And we do have, well, we recently expanded into the state of Mississippi. And
Mhm.
so I know Forge, we do get clients who are out of state. And so I think it could be beneficial for us to have, an additional resource listed for those individuals as like the need there is a little bit different than Alabama. So I think it's amazing that you guys are able to reach out outside of just like the Birmingham metro area. I think that's amazing.
Right. Now there's some logistical things that we of course have to do with out of state patients,
Mm-hmm.
but it is definitely something to at least talk about. And if
Right.
we can't help, then we can help point you towards services that can, because there are a lot of palliative care teams throughout the nation. And so if we can't be that person for you, we can help you find the people that can.
Amazing. And this is not a question that I wrote down. This is just a question I thought about. But if organizations similar to Forge, and us too, if we wanted to collaborate with you guys, what's a great way to do that? Or, are there like specific educational programs that you guys do, or you partner with community resources?
We do. We have several different education resources, and it all comes through that Center for Palliative and Supportive Care. We have a great program that is called African American Communities Speak. So we can teach different providers, different entities such as yourselves on how best to communicate with the African American population as they are navigating healthcare issues. We also have Jackie may be able to help me answer this. She's here, and I'm happy to have her join in and help me answer this question, um, because I wasn't fully prepared for that one.
All right.
No, it's okay. But yeah, we have lots of different ways that we can be a resource and education. So we would love to, and if we haven't got what you need, um, I don't think that there's anybody who would say we would not try to figure that out. Hey, Jackie.
Hey, sounds so good. Hey, so as Audrey said, there's so many different educational opportunities. And when you, again, looking at that website, it gives you those different things that we offer throughout the center because we do a ton of education. And, even if a group of people wanted a specific topic. For example, we do talks on advanced care planning. We do talk, we provide LNEC, end of life nursing education. It's a consortium conference we do every other year. We have the summit coming up in August, actually. It's a 3-day workshop we're doing down, our conference we're doing down at Gulf Shore. So there's tons of opportunity, and we're always open to people reaching out if there's specific things that we can do for individual groups or organizations.
Gotcha. Well, thank you guys so much for sharing that with us. I'm going to go ahead and stop the recording.